Today I'm going to talk about research publications for candidates of the MBU, Malaysian Board of Urology, and the FRCS Glasgow Urology. Currently, a peer review publication is required before the candidate is allowed to sit for the exit examination. So when a candidate is preparing a research paper, he or she must be ready to brainstorm it with the colleagues and senior colleagues. And sometimes some people may think that the senior colleagues or the Ministry of Health consultants do not know much about clinical research. But I think that senior consultants often have experience in reviewing articles. They also know whether they have enough volume to have the correct sample size and whether the project can get sufficient funding and whether the project is feasible in the local context or not. So it's very important that you brainstorm with your colleagues at the very start of your research project. And now many clinicians in the ministry are also taking up medical education courses like this. In fact, the last head of general surgery at the Ministry of Health has a master's in the medical education. Now, it is mandatory, at least for the time being, that you need to have an article in a peer-reviewed journal before you are allowed to sit for the exit examination in urology in Malaysia. Usually, the cutoff is during the last assessment, which is a few months before the exam, although in previous years, we have allowed candidates who just managed to publish just a few weeks before the actual exam. What about the type, quality, and quantity of the research? Right now, there is no hard and fast rule, but case reports are not accepted. We're also particular about the ranking of the journal, unlike in some universities, where you have to have publication in a high-ranking journal before you are promoted. In the future, there may be discussion that maybe we do away with this publication, but instead have a thesis-like kind of project, like for the local master's program, or we gather points when they do presentations or posters at specific national and international meetings. But please avoid publication in the so-called predator journals, although some of them may actually be peer review. So who are those? Which are the journals which are considered as predatory publishing? In 2009, a librarian actually gave a list of the journals, and there's more than 1,000 journals which are classified as predator journals. So try to avoid these journals. So this is what is required in our curriculum. You need to publish in a peer-reviewed journal. And what are the things that the journals will be looking for? They are looking for a subject matter that is worthy of investigation. The information presented is new, and the conclusions must be supported by the data. The conclusions must be supported by the data. What are the timelines? Some candidates are actually very good. They even published in urological journals before they join the program. So that is not counted. Some people may have been collecting data before ethical approval. Again, this is not accepted by most journals. You have to get ethical approval before you collect data. So the conceptualization, the brainstorming, the writing out the proposal may take a few months. And then you submit it for ethical approval of your institution. In most cases with the Ministry of Health as well. And there's a given format for you to fill out the forms. Then you have to start data collection as soon as possible, and this may take up to a year. So during your probation period, once you join the urology program, you can start thinking about your project and writing up the proposal. And hopefully by the end of your 1.5 years, or the most 2 years during your first posting, you should be able to come up with your paper. Once you transfer to another center, it is very difficult to rely on another person to collect data, unless it's a multi-centered trial and you're helping each other to collect data. And this is not only my opinion. Many of the senior consultants that I meet with find that it's very, very difficult to pass on the project to another person to collect data for you. Then the manuscript writing. This can take some time. And because of the Malaysian education system, some of you may not be able to write in good English. So you have to show your supervisors, show your colleagues maybe show an English language teacher for proofreading before you submit it to a journal. And again, you try to submit as early as possible because it may take a few months for it to be rejected or approved, and then you have to resubmit to another journal. The most important thing is, of course, is to get the research question. What is known about the subject? What are the studies already done in your hospital, done in your state, done in Malaysia? You do a literature review, okay? And is there a deficiency in the subject? And if there's a deficiency, according to your scoping review, what is the gap? And can your study fill up this deficiency of knowledge? So these are the things that you must have in your mind. It's no point just doing an epidemiological study or doing a technique study or just collect data for the purpose of a study. And you spend so much time collecting it, and then you find that it cannot be published. What do the journals want? The journals want something new. You cannot say, oh, this study is done elsewhere, but has never been done in Malaysia. Therefore, I do it in Malaysia and hoping to get it published. Usually, it's not of much value. Prospective studies are preferred. Retrospective studies have its inherent problem of bias. You often have incomplete data, and it's difficult to access to physical medical records. There are a lot of limitations for you to get into the medical records room, to take out the medical records, while many of the patients are still ongoing treatment. You need to have authentic data. Often the HOD have to sign at the time of manuscript submission. And sometimes some people, they fake their data to increase the numbers, or they fake their data because the conclusion doesn't fit into their idea. So make sure your data is authentic. The subject matter preferably is something that you like, preferably something that you like. I show this picture of my daughter. She presented a poster at the World Congress of Endourology in London in 2015. And what is her topic? Her topic is the efficacy of antibiotics prophylaxis after ureteroscopy. And I was very impressed. And she never asked me for any help at all. So how did she get about the study? In her university, the department has a list of topics, list of things that they can do, and she just chooses one of the topics, and one of the consultants and registrars will help her with the research. So maybe we should think of something like that in the Sarajan Hospital, or in the Pusat Jantong, or in your center. What is the material that we already have in the department? Then you do a literature search with Google Scholar, look for relevant articles in the Journal of Urology, European Urology, BJUI. Then you brainstorm with your colleagues, especially the head of department and the consultants, and look at what are the material you have in the departmental figures. So if you do, say, 6 resume process a year, is that enough to do a study? Probably not. If you study about the method, is that good enough? No, it's not good enough. So you must think of what the material that you have in the department. Have a hypothesis and keep it simple. Just 2 or 3 variables. Okay, so that subject matter is important, and I think a lot of us are struggling with this subject matter when you embark on research. You must also have a scientific basis of doing your study. Discuss with your supervisor, usually your HOD, and it's important to get input from senior people in the department who have experience in writing, experience in reviewing articles. And during our board meetings, quite often the supervisor doesn't know about the project, or maybe the candidate has just discussed very briefly with the supervisor in the corridor. That's not good enough. You must book an appointment. You must take at least half an hour to explain your interest, your topic to your supervisor or your HOD. And of course, the Board of Urology has a committee called the URC, which looks at research every 6 months. But they're also busy people, and they also don't know what is on the ground. They don't know what is the workload, say, for example, in Kuching. So it's very important that you do a lot of local work first before you present it to the URC. And even then, the URC tells me that sometimes nothing gets done in between the 6 monthly meetings. So you must put emphasis on your research. Don't put it off, and don't take it up late at night, 11:30. Make it as a priority. You try to get at least 2 people to help you to review your ideas. And of course, the language is important. When your manuscript is almost ready, you may have to submit it for proofreading. Some journals will actually give that service. They recommend somebody to read it. Of course, you have to pay for it. And even statistics, you may have to pay somebody to go through your data and whether the statistics are valid or not. Now, statistics is an important thing. You must have a main endpoint and secondary endpoints. And sometimes statistics is just common sense. For example, Dr. Ko always tell me that, everybody's interested in doing research on prostate biopsy because we do plenty of them. But you must look at what you're studying. If you're studying infection rate and you say that, oh, we want to study infection rate between transperineal and transrectal biopsy. But transrectal biopsy, severe infection requiring hospitalization, maybe only 2%. And transperineal supposed to be negligible or 0%. So you want to find a difference between two, you will literally need thousands to come to a valid conclusion. So this is not, it's a no-brainer that you cannot study that aspect of prostate biopsy. And of course, I think all of you should know what is p-value, what is confidence level. Sample size calculation is another important thing. So if you're doing clinical study, you must know how to get a correct sample size. Sometimes you just look at a similar study and see how they calculate it. Or you can use a calculator that is used for that similar study to calculate a sample size. You have to read up on your own and have to have an idea of how to get a sample size. You can have a formal consultation with a statistician in your CLC, or you pay a statistician to help you. But you must tell them what is the purpose, the scientific basis of your study. Otherwise, they also cannot help you to calculate sample size. Then the question of randomization. Of course, the journals like you to have the gold standard, randomized control study. But in actual fact, in clinical practice, it's not easy to randomize patients. Patients may not accept it. Oh, you're giving me no treatment as compared to a group with treatment. And also in Sarawak, following up of patients can be difficult. So anything that requires follow-up of 6 months or 1 year, you will surely have a dropout rate. And you cannot trace this patient back, come back to the longhouse or to the kampong. And so if you have a dropout rate of, say, 30%, what are you going to say? Oh, those hypospadias I operated who don't come back and see me anymore, they are doing very well. But of course, they may be not doing well. They're just fed up with coming to hospital, they're fed up with the treatment, and just live with their complication. So randomization and follow-up of patients, very important so that you don't have a very high dropout rate. Then the submission of manuscripts. There's often a high rejection rate, okay? So you must be very clear before you submit. You limit your conclusions to the study. Do not generalize. For example, in Sarawak, we have a successful study by Kamaraj on the ultrasound incidence of patients attending a government clinic. It's 5%. And the conclusion is also that it's equal in both sexes. But we know that internationally, we have more men than women having stones. And remember, do not generalize it that this is the incidence of stones in Sarawak. So make sure that your conclusions are limited to the study. Even if it's a negative study. For example, in one famous study, they did a study on MR, transperineal, and transrectal biopsy. But actually, the transperineal, they do 50 course, and 1% admitted to ICU for 1 month, and 3% go to OT for clot retention. And they still concluded that the transperineal and transrectal biopsies are just as good. It's not just as good. So even if it's a negative study, you must report it as a negative study. So your conclusion must in line with your study objective. Then the question of ethical and finance. You must get ethical approval before any study, any data collection. Of course, if there's no patient intervention, your ethical approval is likely to be fast-tracked. Of course, you must get approval from your institution. In this case, the Ministry of Health. Finance, you can get from various sources. The NKF has been known to be generous. They gave us 200. They can give you 200,000. We can get some money from the Malaysian Urological Foundation, but they don't have much money, maybe about 10,000 per study. Sometimes we can get money from the trade, which is not linked to their product. But be prepared to spend some money yourself. You're all paid a full salary, so sometimes you have to pay for the study or the cost of the publication. Of course, you can also ask for subsidy from various sources, including the universities. But you try to ask it upfront. Don't wait until the thing is already published, and then you say, "Oh, there's some money to be applied for in MUF," and then you start applying for the sponsorship. All these things can take up to 12 months, 12 months. So get ready to start on the project as soon as possible. The next question is the question of ownership and authorship of the article. Now, the raw data belongs to the department. Who in the department? The HOD of the department. Because sometimes the journals can ask for it later on. Maybe somebody want to replicate the study. The study material belongs to the department. The resources that the patients belong to the institution. So don't take away the data and make sure it's available to the HOD. You have to be the first author. Of course, if there's a lot of data collected, some of it can take turns to be the first author. I noticed recently some of the studies you only have 2 people as authors. I think during my time we can allow up to 5 people to be responsible for the publication. Now I think there's no limit to the number. So you try to get friends to help you, get colleagues to help you, and you can include their name so that they can put on a CV that when they've gone through the urology department, they've taken part in research. Most journals require some kind of payment when they actually come to publication, whether it's for the table, for the color print. The SIU is supposed to be a journal that right now still doesn't ask for payment. So get ready to pay some amount of money. So this is a letter from SIU. I think some of you may receive it. This is a new journal. So right now they don't have requires fees to submit or publish, and it's supposed to be an international journal. So they are more likely to take articles, say, from developing countries as compared to BJUI or JEuro or European Urology. So things like, which are very, very common in the developing countries, like tuberculosis. Now we have a very successful paper from Kota Kinabalu on tuberculosis, stones, ureteroscopy, different kinds of prostate cancer, different kinds of bladder cancer, which are a little bit different in developing countries, or maybe even in a state like Sarawak. So you can submit it to different journals of different ranking and get ready to move on to another journal if you are rejected. So when a reviewer looks at a manuscript, we can reject upfront, we can accept with minor revision, we can accept with major revision, or we can just accept it upfront. So I'm a reviewer for the Malaysian Medical Journal, and of course, if you wish to submit to the Malaysian Medical Journal, so you have to decide who are the people you want to be first author, second author, etc. And when you get your manuscript back to you, you must try to revise it almost immediately, as soon as possible. Definitely within 1 or 2 weeks. Don't leave it for months, okay? And spend time. Be prepared to spend up to 4 hours with your colleagues, with your fellow authors to review the manuscript. So this is my last slide. Some of you may think that research is boring, but actually if you take research as part of learning and teaching, you will learn to enjoy it. Those of you who associate with me will know that I learn a lot from my colleagues, from junior, from senior, and even from medical students. So it's this learning, teaching, research is a way of life in urological training and for the rest of your life. So you must actually learn to enjoy it, and the urology department in Kuching is supposed to be one of the most cohesive in Malaysia. So you should be able to get your project up and going after 6 months, and hopefully by the end of 1.5 years, you get a paper ready for publication. Thank you very much for your attention.